New COVID-19 cases have fallen in the United States, but health officials are warning Americans not to get careless about coronavirus precautions. They fear the variants spreading around the world may cause a new surge in the spring. At least 27 million Americans have tested positive for the coronavirus. More than 463,000 people have lost their lives because of complications linked to COVID-19. In South Africa, health officials have paused the Oxford-AstraZeneca vaccine rollout after a study found it was not effective against the new variant first detected in the country. I want to bring in Dr. Leo Nissola now. He is a physician and immunotherapy scientist. Dr. Nissola, thank you so much for joining us. I want to start with getting your take about South Africa's decision to pause their vaccine rollout, considering the small size of the AstraZeneca study and the fact that it has yet to be reviewed by peers. Does this indicate there's a chance the study's results may not be entirely accurate?
Thanks for having me. First, let's just acknowledge that we're building the plane as we fly it in this pandemic with clinical development and developing those clinical studies and setting them up and designing those studies is definitely not something that it's easy or quick to do. So some of them may have some challenges, and AstraZeneca has faced some hiccups through the course of the development of these vaccines. They've recruited a lot of healthy individuals, which makes it even harder for us to understand the true benefit of their vaccine based on the data that was published so far. So the jury is still out of whether or not it still makes sense to vaccinate the population with AstraZeneca's vaccine based on the data that they've released so far. And there are some more studies coming underway and research based on the clinical data from the patients that they've enrolled, which were mostly healthy young adults. Given the small sample size, it's very hard to interpret accurately to understand if the populations that actually need this vaccine the most will actually gain any benefit from it. So halting the vaccination plan, it's heartbreaking because we need every help that we can get in the fight against this virus.
Absolutely. That's exactly right. And I want to ask you more about these new variants, because here we are 11 months into this pandemic. New variants are emerging across the world. Do you see things getting worse before they get better? Or do you think, the declining numbers that we're seeing here in the U.S., we can sustain that?
It's really hard to predict. What we do know is the viruses tend to mutate, and they mutate faster when they infect new people that have not been infected before, especially when we're pressure testing this virus by giving it vaccines, by giving it convalescent plasma, by giving it immunotherapy, by giving different types of vaccines, where we are still seeing new infections with new variants in new, healthy people. So I'm concerned that we are now shifting all of our focus on vaccination plans and vaccination campaigns, which we badly need, and still forgetting that we still need to prevent the spread of this virus. So I think it's very important for us now to focus on the measures that we know works, like masking, physical distancing, and preventing new infections. I think this is crucial for us to understand how the future is going to look like, whether we're going to need new boosts for these vaccines because of novel mutated variants, or whether we're going to be able to walk into the new year next year healthy and worry-free from COVID.
And speaking of the vaccination effort, as time goes on, more and more people will have received their second shot. So there will be a pool of people who are fully vaccinated. Is it safe for those people to be near other people who've also been fully vaccinated without the same precautions that the rest of us are taking?
That's a very important point, and I think we should discuss it. For now, what we do know is that research shows that likely individuals that were vaccinated are maybe not going to be spreading this virus, but we don't know that for a fact, are just some hypotheses and some assumptions that scientists that have been researching this virus are making right now. What I do think it's difficult is preventing people that are fully vaccinated from rejoining society. And I think we should have an active plan or multiple plans to not only reopen businesses that have been shut down because of this pandemic, but also allowing folks that are fully immunized to carry on with their daily lives. And I think there needs to be a more vocal public health discussion around these topics.
Right, whether or not they can phase fully back in and leave the rest of us out in the cold. No. Dr. Leo Nissola, thank you so much for joining us. We really appreciate your insight.
Thanks for having me.